Does food reverse heart disease? Does exercise? Which one is better? Today, I'll compare the two. And if you've been watching my videos, you have seen how food is important in reversing heart disease. But I want to show and explain why exercise is so important too. When a patient walks into a cardiologist's office or a doctor's office with narrowed arteries, plaque in the arteries, the doctor says three things: eat better, exercise more, take a statin, maybe take the aspirin. The eat and exercise advice is the most common advice in medicine, but it's also the least specific. How much exercise? At what intensity? For how long? And if you had to choose only one lever, food or exercise, which one would actually shrink the plaque and reverse your disease? I went looking for the imaging evidence. Ultrasound, CT, intravascular ultrasound of the arteries, the hard proof, the end results. And what I found surprised me. I reversed plaque in both my carotid arteries in an incredible just 3 months. I thought there were others who did so, but I have yet to find any case study that shows the speed and degree of reversal. I realized my reversal is an extreme outlier, but it is because of my protocol, which few people are doing. If you understand how I reverse my plaque at record speed, you will understand how you can do it too, even at an easier intensity. It'll just take longer. The most important exercise and plaque study is the Senate trial. Vester-Beckmo in the European Journal of Preventive Cardiology in 2023 had 60 patients with stable coronary artery disease. Half were randomized to high-intensity interval training, 80 to 85 to 95% of peak heart rate, unable to talk when you're exercising, 2 to 3 times per week for 6 months. The other half follows standard public health guidelines. Unsupervised moderate activity. All were on statins, so that was the same. After 6 months, intravascular ultrasound imaging showed atheroma regression in a high-intensity interval group, not stabilization, regression. This was the first randomized trial to demonstrate that high-intensity interval training HIIT exercise at sufficient intensity can reverse coronary plaque. Why does intensity matter? The reason intensity matters is a concept called shear stress. Here's how it works. When blood flows through an artery, it creates friction against the endothelium. That's the living single lining of the blood vessels. At low intensity exercise, that friction is gentle. At high intensity, the friction increases dramatically, and your endothelial cells can feel the difference. When shear stress reaches a critical threshold, it activates an enzyme called eNOS, endothelial nitric oxide synthase. eNOS provides nitric oxide, the single most important molecule in vascular health, and nitric oxide dilates arteries. It prevents white blood cells from sticking to the vessel wall. It inhibits smooth vessel proliferation, and it blocks LDL oxidation, which is the very first step in plaque formation. But here's the part nobody tells you. At moderate walking intensity, shear stress is too low to significantly upregulate and increase eNOS. You need to push your heart rate above 80% of peak to generate enough blood velocity, enough shear force to trigger robust nitric oxide production. That is why the Senate trial succeeded at 85 to 95%, and why moderate exercise studies only slowed disease, but not reversed it. The endothelium has a threshold intensity, and most people never cross it. Your artery wall can feel how hard you're working. Below the threshold, it waits. Above the threshold, it starts to heal and reverse. But there's a subtlety that the Mark II study revealed. Engverin in the journal Circulation 2023 studied 289 athletes, followed them for 6 years with coronary CT scans. Vigorous exercise, 6 to 9 METs, slowed calcium progression. What's a MET? A MET stands for metabolic equivalent of tasks. And 1 MET is like sitting still, and 6 METs is like brisk cycling. 9 METs is like running a 10-minute mile. Vigorous exercise above 9 METs paradoxically increase coronary calcium. So too vigorous and too high exercise increased shear stress that became turbulent. This led to plaques that became calcified, but calcified plaques are stable. They don't burst. They're not the soft, vulnerable type of plaque that ruptures and causes heart attacks. So exercise was remodeling the disease into a less dangerous form, but increased the calcium score. And the very first plaque regression study with exercise came in the 1990s. This was the Dean Ornish Lifestyle Heart Trial. A 3.1% stenosis regression after 1 year of moderate exercise combined with a 10% low-fat, whole food, plant-based diet, just like Dr. Esselstyn, but Esselstyn didn't stress exercise, sleep, or meditation like Ornish did. So the best predictor of improvement was not how much someone exercised, it was how much their fitness improved and the intensity in which they did it. So quick question before we go on. What's your exercise routine? I'm curious. I exercise a lot. I cycle typically about 100 kilometers a week. How many times you ride or how many times you exercise? And do you reach the 85 to 95% heart rate zone, the threshold? Drop your answer in the comments. I'm very curious. I'll try to read every single one. The 3 foods. Now consider foods not as a supporting actor, but as the lead. Talked about this often because they're so magical. Pomegranate juice, 19 patients with carotid stenosis, just 50 mils a day. 50 mils, that's 7 grams of sugar. A lot of people ask me, isn't that too much sugar? Well, just eat it at the end of your meals and go walking for 10 to 15 minutes. The benefits far outweigh that 7 grams of carbs. And in 1 year, the carotid intima media thickness fell 30%. That's the average. The control group, it worsened 9%. So very significant. LDL oxidation dropped 90%, blood pressure dropped 12%. That's better than an antihypertensive. And the guardian enzyme of HDL that protects HDL, which has the capacity to carry the cholesterol from the plaque in the arterial wall down to the liver, peroxygenase 1, it rose 83%. So increased HDL functional capacity. There's 30% regression from juice alone in just 12 months. I keep on talking about it because I think it's so marvelous. And if you've heard this but have not yet done it, go out and get organic cold pressed pomegranate juice. Nattokinase, I talked about as well. This dissolves the fibrin network. This was touted by Chen in 2022 with 1,062 participants, quite large, but at high doses. So if you're on blood thinners, you should consult your physician, but definitely high considerations because of the increased risk factor of bleeding. 10,800 fibrinolytic units per day for 12 months. And the carotid intermediate thickness decreased 36%. The plaque side decreased in the carotids as well. But at 3,600 fibrolytic units, there's no effect at all. So it's very dose dependent, just like medicines. So if you're not on a blood thinner, supplement up to 10,800 fibrolytic units. And then there's flaxseed. In the FlexPad trial by Rodriguez in the journal Hypertension in 2013, he showed 110 patients with peripheral artery disease, 30 grams of freshly milled flaxseed daily. After 6 months, systolic blood pressure dropped 10 millimeters of mercury. Diastolic dropped 7. That reduction is equivalent to adding a blood pressure medication. Just flaxseed. Carotid plaque progression slowed. It didn't reverse, it slowed down. So the verdict, exercise regressed plaque only at a threshold of higher intensity, 85 to 95% of peak heart rate, 2 to 3 times a week for 6 months. Moderate exercise slowed disease but did not reverse it. And 3 foods produced 30% arterial wall regression in the carotids, blood pressure reductions equivalent to pharmaceuticals in 12 months. So as standalone intervention, here's the nuance that matters. Exercise does things that food cannot. It generates nitric oxide. It strengthens the endothelium. It converts vulnerable plaque into stable calcified morphology. Exercise is not optional. It's essential. The question is which lever you pull first. First, you must fix the biochemistry, and what does that best is food in order for plaque reversal. Then exercise will accentuate and enhance and synergize with that food so you have much greater benefit. Hit to regress the plaque on top of the diet. So everything I showed you today, every study, every dose, the full protocol is at ham.com. Links in the description below. I'm Dr. Kevin Ham. I was trained as a physician, but I'm also a patient, and I want to empower people like me and you with the health education to reverse their illnesses. I'm not just reversing my own heart disease, I'm helping others reverse their high blood pressure, their diabetes, visceral fat, and their high cholesterol, naturally and quickly. So empower yourself, take control of your own health, subscribe now, and follow my journey. These videos save lives. Tag me, like, subscribe, and ask your questions below. Click one of these videos and share it with someone you love. Together, we will save lives. For my up-to-date learnings and more, visit me at ham.com.